Hi, my name is Megan Kelly. I'm a psychiatric nurse practitioner. I am also a mother of three. I have a 12-year-old, an 8-year-old, and a 3-year-old. I work part-time in an outpatient mental health clinic, and I also work part-time in private practice. So at this point in my life, I would say I'm experiencing burnout, and I've been trying to kind of figure out ways to get control over my life and um, provide better care, be a better mother, have a sense of like organization and not this constant underlying anxiety and chest pain, because knowing that I have so much work to do and I have so many emails to return and I have so many phone calls to return and I have so many meds to order. Um, it's very overwhelming. So I have tried numerous things and I have been unsuccessful. So my main goal in making this videos is to provide support to other nurse practitioners, physicians, healthcare workers that are also in the same boat and are just totally burnt out and don't really know what to do. I think it's important, especially, if you're a mother, it's even worse because, if I did have the additional time outside of work to do, self-care type of things, that would help for sure. If I was able to, meditate or go for hikes or go away with my girlfriends or whatever. But when you are a mom and you have children, and especially when you have children who are active in sports and you have sports every single night, the weekends are filled with sports, it's even more difficult. So I know personally managing, my work and then also managing my kids' schedules there's not enough time in the day. It's absolutely impossible. So somewhere along the line, you're going to let somebody down. And I think for most of us, the priority is our children, our families, and making sure that we are being good mothers and that we have worked so hard to get to where we are because ultimately we want to be able to provide a good life for our children. And now we're in this situation where we feel like we're unable to do that after all of this hard work. So I would say some things that really are important to discuss when kind of doing some research on burnout and kind of discussing what other people do when they're burnt out. There's a lot of like this generic, what can you do if you're burnt out? If you're a nurse, if you're a provider, what can you do? And some of the things that they say just aren't really realistic. So trying to figure out some actual solutions and help other people gain control and feel like a sense of control, like they're actually providing good care and that they are actually being a present mother and not just kind of running around, 24/7 and, not just like screaming at everyone to like, get on board, because that's kind of how I'm at this point. Um, so I'm going to share my screen really quick. And talk a little bit about burnout prevention, recovery, and I'm just going to skim through it really quick. So, burnout is a syndrome resulting from workplace stress that has not been successfully managed. It's characterized by three feelings of exhaustion, yes, depletion or exhaustion, yes, increased mental distance from one's job or feeling of negativism, or cynicism related to one's job. Okay. Symptoms of burnout: physical, mental exhaustion, lowered immunity, falling sick more often, frequent headaches, back pain, muscle aches, change in appetite, impending dread about work. Yes, I mean, I don't know how many of you, I work Monday to Friday, so I mean, on Sunday my anxiety is just so intense. And Monday morning, when I'm trying to, get my kids ready, make 3 lunches, get backpacks ready. I have 3 separate drop-offs in the morning. So in the middle of that, just knowing that I'm going to be bombarded, it's overwhelming. Irritability, anger, feeling helpless, trapped, defeated, procrastinating, taking longer to get things done. And I think I often procrastinate because I don't have any time for myself. So if I'm actually doing something that I enjoy doing, like say, I'm just, you know, online shopping and just like, skimming through clothes on like the Gap website. And, I like to fill up my car and then apply a discount. And then ultimately I don't really buy it, but I do that like on different types of sites. That's kind of like a way that I like to relax. So sometimes I end up doing that instead of doing my work because I have no time. And it feels good to kind of take a break and like disconnect. So yeah, I guess maybe that takes me longer to get my work done, but I think there's obviously other things that lead to it. Um, Compassion fatigue. So blaming others for your own suffering, complaining about your life or your work, poor self-care, stress, muscle tension, difficulty concentrating, overeating, insomnia, bottling up your emotions. So yes, blaming others. I would say that I mainly tend to blame the overall system. So I tend to blame the operation and how they structure it and their expectations and the lack of organization and clear roles and duties um, for employees and staff that are in the overall picture. So I think a lot of it kind of gets dumped on the provider and it makes our job impossible. So I get really angry when it comes to stuff like that, or when it comes to certain things like meetings or emails that are just a waste of time, just, distractions for me. I get, like, why am I on this email thread? Why am I in this meeting? Like, like I have a zillion things to do. So, that gets me upset. Also, another trigger for me, and I'm sure a lot of people can relate, is other mothers who don't have to work. So stay-at-home moms who are like able to just like, you know, do their own thing. They kind of know what's happening at school and sports. They may be the type of parent where you get to a sporting event and they have a bag packed with, snacks and drinks, and their kids' uniforms are like, freshly cleaned. And um, that gets me really angry because I can't do that. And, I'm like a hot mess. Like, I'm just like, my kids are wearing dirty uniforms. I have no food packed. We're eating McDonald's. Um, and then if they want to talk about what's going on, how is everything, it's very hard to relate to people because all I want to do is just like complain and say like, I'm miserable and I'm tired, and you don't understand that because you don't have to work. So, and that's not fair either. So, okay. So 44% of physicians experience burnout. And I would say too, with physicians, and residents, especially, the schooling is just unreasonable. And the amount of hours our residents put in is completely not healthy. It's unrealistic. It it's not good for their family life. So I would say, especially for residents, I can only imagine what the burnout is. And then 1 out of 3 nurses having high burnout, I would say it's even more. And then another thing that kind of adds to everything is the debt of school. So average debt of medical school graduates is 192,000, right? And physicians say they burn out because 29% say they burn out because of insufficient compensation. So, you are struggling to pay your bills and you have this, now you have your student loans to pay back, but your credit's probably not great. So, you're kind of like in this trap. So unless you really like overload yourself with work, and try to make this money back, this is now adding to the burnout as well. So, all right. Half of workday hours are spent charting. Yes, definitely. And that would, that's a whole nother thing, the electronic health record, what a disaster. Really, that's another one that drives me crazy, depending on the system, you know what I mean? if you have one that's like legit, like operational and like works as it should work, that's great. I know in my private practice, I use Dr. Chrono, which can be, there's always like, there might be like a lag or random issues going on. But overall, like, when it's working, I can see my patients, I can chart very quickly, order meds, lock and sign my note. If I need to send a fax or send them a message, I can do that. It's very quick. But when you use these older programs, it is like you're just clicking buttons. You can't even, I can't even pull up my old, like my previous visit doesn't actually like pull up. So I have to go back and copy and paste everything onto the new note. So that in itself takes about 15 minutes, which is just totally ridiculous. 45% of healthcare workers get less sleep. And a nearly quarter of physician burnout is from lack of control. I would say it's even higher than that. Stages of burnout. So we kind of went over that a little bit, but just kind of this onset of stress, chronic stress, burnout. And then, you start to doubt yourself and you're noticing behavioral changes. And I think that's important thing to really look out for. Like you're just not acting yourself anymore. Like you are just kind of shut down completely. You are depressed, you're tired. Mentally, you just don't have anything left for anybody. It's not healthy. So this was a little survey about male and female providers and the the level of burnout rates. And so it says, do you have children and need to worry about childcare, remote learning, sport activities, play dates, teacher conferences, book fairs, household chores? Well, good luck. You are screwed. And it's true. You're screwed. Burnout, intend to leave, intend to reduce hours, and anxiety and depression by childcare stress. So that is CCS. So it took a look at 408 respondents, and it was conducted recently, 2022, so when the pandemic was going on. So there was this high childcare stress burnout was associated with 80% greater odds of burnout in all healthcare workers. So if you look over here, this would be high burnout, right? And when you look at childcare, right? You see female here, and their burnout rate is, significantly higher because now they have this childcare stress. And look over here, high reduced hours. So someone who does have reduced hours, how is their stress? So female high, it's still elevated amongst, male providers. If you look over here, high anxiety and depression. So right here, female with that have to oversee childcare, again, that is going to be higher. And then males that have high childcare needs, they are also same thing. But you can see that, if you don't have to worry about childcare, that your overall risk for burnout is going to be lower for sure. So next thing is, all right. So I kind of, spoke about this before, but, half-ass parenting. My kids come first, but I can't afford to leave. So women are caring for patients during the pandemic, and then who's caring for them and their families? No one. We just, we're just expected to somehow pull it off, and it's just not realistic. It's not realistic at all. All right. Residents are particularly affected by gender disparities. Several studies illustrate that women trainees are less likely to have partners that do not work full-time. So if you're a female resident, chances are that your husband also works full-time. So the burden of childcare and household duties is obviously, I would say in most parts put on the woman. So, their burnout rates right here are going to be a lot higher. So in this thing here, it says that, which is interesting, 40% of men had partners who did not work compared with 0% of women. So if you're a male resident and you have children, typically you have a wife who isn't working, there's, 40% chance you have a wife who isn't working. Which that makes it easier because now you have someone overseeing those things. But if you're a female, chances are your husband's working full time. So you're not lucky enough to have those options. 85% of women had spouses or domestic partners who work full time compared to 44% of men. So cause of burnout and how to identify and recover and resolve them. So what leads to burnout? And I think it depends on what area you work in, what kind of setting you work in. And so 49% is too many bureaucratic tasks. So admin type stuff, charting, paperwork, insufficient compensation, 43, lack of respect from administrators, employees, colleagues, 43, too many hours, 32, lack of respect from patients, 26, and then stress from social distancing, 20. So at this point, I mean, the pandemic's at a place where I don't think the social distancing, remote learning would be that high. Lack of respect from patients. I work in psych and I've been in psych for a long time. So I don't, that's nothing that really affects me. I could have a patient like scream at me and yell at me and do whatever. I don't, that doesn't bother me anymore. If I was newer, yeah, I could really see that might affect me, but for now, no. Too many hours at work. When I leave work, I tend to leave work. That's it. Even if I have charting, I'll try to do charting, at a different day or whenever, or in my situation, I have so many unsigned notes. It's like ridiculous. And I constantly have billing sending me emails to do my notes, but I don't have time. So, lack of respect. In certain situations, you know what I mean? But overall, it's not like, I don't feel like I'm disrespected, but I think that it's more of a chain of command that people tend to not understand or they're not really aware of that can be annoying. Insufficient compensation. Yeah. I mean, if I made more money, then, I'd be able to afford certain services. I could have a housekeeper in my house more. I can have, I don't know, someone that does my laundry. I could have, certain things. It would make it a little bit easier. And instead of me trying to do everything on my own. And, you can't afford to have some, like a house manager, to oversee things. And of course, just I would say the charting, the emails, the phone calls, just constantly everything thrown at your way. So I don't always transfer calls, but when I do, I prefer a cold transfer. And I think this is sometimes what the secretaries do at my work. Unfortunately, not all of them, but a lot of them. Yeah. Okay. So just kind of skipping through and how has burnout affected your personal relationship? 31% say no. 69 say yes. I mean, this isn't really an active, representation because this, are you married? Do you have kids? Are you single? Whatever. I would say if you're married and you have kids, it would be 100%. I'm just guessing. Okay, let's keep on going. And how do you resolve it? So, having these goals, having supportive organization culture, having skilled team leaders, clear team responsibilities, roles, that is very important. Safe environment, interpersonal conflict resolution. So I think that's a big thing, everyone understanding what the purpose of their job is, what are they supposed to do. I would say a lot of times everything just kind of goes, oh, well, ask the physician, ask the nurse practitioner, ask them. And a lot of times it's not something for us to even be asked about. It's something that should be handled by either administrative assistant, a medical assistant, an LPN, a nurse, whatever. So we'll just keep on going. Okay, so administrative burden, yes. Most clinicians are going to complain about the excessive amount of time that they spend on these tasks, and it's divided into patient care and non-patient care. So patient care is looking up lab values, documenting history and physical examination, and then non-billing being non-patient being like, kind of like the billing activities. So physicians view administrative tasks as less meaningful work and find meaning in one's work as an important mediator as burnout. So basically, the more administrative burden, the higher rate of burnout. Workflow interruptions and distractions. This is a huge issue for me. So it says a study of 422 family practitioners and general internists, adverse flow work defined in terms of pressure and chaotic environments was associated with symptoms of emotional exhaustion. Interruptions and distraction are known to disrupt clinicians' workflow and are associated with lower quality and less self-care. So you are, seeing a patient, and you're in the flow of your day, you're back to back with patients, but you're also at the same time getting, these emails, and phone calls, and emergencies. And how can you see your patients, chart on them, look at their labs, order their meds, do all these things when you are being interrupted? If you're with the patient, that should be time that everyone on the outside sees, not to distract the clinician, unless it's an emergency. And defining emergency in healthcare, I think, is difficult, because I know as a nurse, I was always taught, like, if you don't know something, ask the doctor. Like, if there's an issue and you don't know how to handle it, that it needs to go to the doctor. Yeah, of course. But if it's really an emergency, it can wait until, if it's an emergency, call mobile crisis. That's what they're there for. If it's an emergency, you're in the hospital, call the nursing supervisor that's on for the day. It doesn't necessarily mean, interrupt the doctor, especially most times it's not an emergency and it's something that could have waited. So, and workflow is poorly designed to meet clinicians' needs, leads to frustration, creates time pressure. Yes. So, you're seeing people and you are like, oh my God, I didn't even chart on, the last 6 patients I saw. I don't know if I ordered their meds. I didn't look up their labs. I have to fax this. I said I would call their doctor. Okay, that's a lot. How are you going to do that? I have no idea. And then you have these, interruptions, on top of it. So, while you're doing all that, maybe you get a phone call from a social worker saying, oh, just want to let you know that blah, blah, blah was feeling a little depressed today. So I told him to reach out to you to let you know. Nope, sorry. I have too many patients I'm seeing. I have too many duties. If you think I'm going to call this person who's a little bit more depressed, most likely because he's not taking his medications, then what should happen is he needs to schedule an appointment with me to see me so we can discuss it during an actual visit. So visits are not conducted over the phone. I cannot talk to clients over the phone because I don't have any time. And if you are just to call a patient and say, oh, okay, let's make an appointment so we can schedule this. Majority of the patients, you can't get them off the phone. So that's not even realistic. So it should be, the social worker should know, hey, why are you calling the nurse practitioner? Have them schedule an appointment. If it's an emergency, they can be booked for an emergency slot. Okay, next. Inadequate technology. Yeah. It's horrible. The computer system we work, I don't know how to go back, is just horrible. So, the purpose of having this technology was to enhance job performance, but I think in most cases it has just caused more stress. The system's working. Our system's constantly down. Like you're trying to work and like I can't even see anything. I don't even know what patients I have. I'm trying to order meds. Oh, I can't order meds. The integration with labs, we've gone through 3 different lab companies. So there's all, different ways. It just never integrates. So, now the system's, down. So when do they think I'm going to be charting? I'm just going to stay at work until another 6 hours or 8 hours of work charting. That's extra time I should be paid. I would actually rather it be like, back in the day when there was just like an actual chart and you just like charted on the chart. That would be so much easier, just, open it up, write your orders, write your note, blah, blah, blah. And then the secretary goes through and then, does what needs to happen. and everyone can read your chart and go from there. Oh my God, it would be so much quicker. It's crazy. And going through duties. So I think a lot of times this is important because there isn't a clear cut, where I have worked in the past, there's never like a clear cut, like realistic responsibilities and duties of the team. And in order to work as a team and provide, um, evidence-based type and effective and, quality care, you need to work as a team. And to work as a team, everyone needs to know what their responsibilities and duties are. And I'm sure people have like really funny stories of like certain duties that they're supposed to do that make absolutely no sense, like at all. I remember I worked at a job when I was a nurse, and it was like, that you would do the intake and you would put if they have any allergies or whatnot, but you would have to order their meals. But for whatever reason, only the nurses were allowed to contact the kitchen. And I don't know why. So anytime there was like food issues or someone didn't get a meal, you're being bombarded with calling the kitchen, being like, I need a cheeseburger with lettuce. And it was really bizarre. And, at that time it would be like it could be one nurse, depending on the hours, with 27 patients. So I think I probably should be worrying about, passing meds and doing, and we didn't have anyone doing vitals, so the nurse did vitals. But no, I'm calling the kitchen to like order mayonnaise. I mean, it's just stuff like that. That's ridiculous. Okay. So we see these are some of the duties that are listed. We know these. Duties not listed. So orders and review labs through EMR that often isn't working, or lab orders that don't go through. Okay, I didn't know that I was gonna have to spend so much time doing that. Issues with on-site lab phlebotomists that is normally on an hour-long lunch break. Once the phlebotomist is available, he or she is unable to offer any solutions. I would say in terms of being disrespected, the only time I think I have been really disrespected is by a phlebotomist who basically told me she was on her break. Not, like, how dare I come over and ask for a client to get their labs done. I don't know. So, making sure that the outside lab company is aware of how the facility runs, their expectations, and, having appropriate, I don't know, manners, like knowing how to work. Everyone likes to go on these like hour-long lunch breaks. It's so funny. I don't even get a lunch break. Attempt to get a W-10 or discharge summary from clients that are recently inpatient. So if I'm seeing someone that was just inpatient or was in rehab, whatever, and now they're in my office. Oh, where's the discharge? There's nothing. Oh, okay. So I have no one that, I could try to ask for that help, but I know it won't actually get taken care of. So a lot of times I'm the one doing it. I'm signing the release of information. Then I'm faxing it over. And most of the time I don't even get anything back. So that should be stuff that is already taken care of, that is there for me to see when I'm seeing the patient. And what else? What other things come up that are duties you're expected to do, but really you shouldn't be doing, and it should be delegated to somebody else? I'm interested to see, some other things. And I think, coming up with solutions for what are jobs, certain, employees, what their job is and what they should do. So a medical assistant, they can schedule appointments, they can get blood samples, they can do data entry, they can do vitals, they can answer phone calls, recording, updating medical history and contact information and patient files. I know that I schedule all my follow-up appointments. But yeah, I mean, a lot of times there is no medical assistant that's doing any of this. So I don't know. Medical receptionists should be able to have heavy telephone contact, able to provide thorough, detailed messages, reminders, recalls, scanning, uploading documents, experience with prior authorizations and referrals. Absolutely not. no way, Jose, does that happen. EMR competent, understanding scheduling, acknowledging of medications, let the patient check in and out for appointments. I mean, I schedule a follow-up. I don't know how other people feel about it, but I don't know. I mean, doing the follow-up isn't that difficult. So for me, that's not a big deal. And then, working with the billing company if there is something going on. A lot of times patients will be like, I got this copay, it's like, $8 million. What do I do? And then, or I get phone calls forward to my email about billing stuff. Why are you forwarding that message to me? I'm not the billing department. And then ordering lab office supplies, I would say so. A nurse care manager. I wish I had one of these. They create and manage the plan of care, and they are advocating for them and, understanding what type of needs that they have. Schedule their appointments, medical appointments, follow up to ensure they attend them, education guidance, and they serve as, a liaison between patients and insurance providers. That would be good. I know a lot of times that it could be a caseworker, that does some of these things as well. And, that's important. And I know we have really good caseworkers that are helpful, but again, it's limited on how many we have, how many clients we can serve. So these are some things, we have a problem here. How do we solve it? Right? It's a disaster. We need a solution. A lot of the solutions that are provided to us are just, a joke. Please do not say time management and organizational skills. These are not realistic. Burnout is created by poorly run healthcare facilities. Lack of oversight or clearly defined roles and duties. Someone needs to be overseeing these things and making sure that they're consistently operating the correct way. Okay. It doesn't mean you say it and then no one does anything, because people are going to go back to their old ways. If you have someone that is seeing this and on a regular basis, this is their job, they're making sure it's running clearly and functionally, then I would say that the providers are going to be happier, the patients are going to be happier. Hospitals and outpatient facilities exist to help clients that are in need. And in order to do that, the facility needs to make money. Yes, of course. If they don't make this money, then these facilities are not going to be open. And we understand that. But a lot of times, things can be set up from maybe more. I know there's been places that have been more, clinicians have started the company and set up things, and really they're not medical, so they don't understand the medical needs. So the roles and duties are not really appropriate. You need someone that's in healthcare and understands these things. So but yes, we understand they need to make money, but they need to have the right people running them that understand how to run them. And that's the problem, that they don't have that. Happy employees that are satisfied with their work and don't experience burnout will stay with their employer. So happy employees equals productive and effective patient care equals employee and patient retention. So, if you're the type of facility that you have, people leaving left and right, and you can't get someone on and you're always short, and that's a good sign that the system is not working, And then healthcare provider, motherhood, family burnout. I definitely think a lot of us are in this boat. So some tips, right? Do it now. Never try to handle emails twice. Read an email, respond, and then delete it. Okay, I don't do that. Normally what I do is I read the email and then I go, why are they sending me this email? I don't understand. Why are they emailing me? And then I get annoyed and then I just don't respond. But it would be a lot better if, I did these things. So kind of going through here, and my next video, I'm going to go through some of these, different ways to try to prevent burnout and delegate tasks and, define your limits. So that for now. Oh, good. Okay, stop share. I'm not very good at doing this whole like share screen and all that stuff. So I hope you enjoyed the video, and the next video is going to be about what we can actually do here, and thinking about ways to solve this. And I would love to hear some advice, some tips, and really like realistic tips, nothing that is like, I like to drink green tea on my lunch break. Okay. Like realistic stuff, like I like to drink Coke Zero excessively throughout the day. This helps me stay awake. So, and not anything like, talk to your boss and let them know what's bothering you. Like, okay, if you've worked in healthcare for a long time, you know what to expect. So real things, how do we solve this? And how do we kind of make it, something that we can set limits and expectations so that, it changes, and it changes everywhere, so that people are happy in their jobs. So, all right, well, hopefully everybody has a nice day. And I will be posting another video later in the week. Thanks.